for many, the new year brought new and higher costs for health care. The Affordable Care Act subsidies tax credits expired at the end of last year with no definite plan to replace them. And since then, U.S. House of Representatives have passed a bill to extend those subsidies, but that still has to be passed by the Senate. Well, this morning, your Gunter Schroeder is live in the medical district with more on what people are being forced to do until those are passed. Gunter.
Well, the open enrollment deadline of January 15th came and went, and still no final decision has been made on extending Affordable Care Act subsidies in Congress. And in regions like the CSRA, they could feel the effects of skyrocketing health care costs more than others.
I empathize with them because it's hard. This isn't the only bill that they're facing that's increasing.
The new reality of healthcare costs has hit home for brokers and families.
It's harder to sit down with a client and explain the cost. It's hard for me as a consumer to sit down and look at my plan last year and the year before and say I'm getting the same plan, but I'm paying a lot more.
And for those on low income in the CSRA, the safety net of subsidized health care has disappeared.
We have a higher concentrated percentage of people who are affected immediately. And so that does definitely present a challenge for us. When you're getting health insurance when you're low income because of the subsidy, and then the subsidy changes to where you can't, that's when people fall into a hole.
And options are also limited for the many small businesses locally.
The problem with group and why some of these smaller businesses can't get into the group is because it costs too much for the employer. If you're empowering business owners to grow a stronger workforce through offering benefits, all pre-tax, it's going to give them more advantages in the workplace.
With no long-term solution in sight, brokers are unified in their hope for something short-term.
I do hope to reach out to a lot of small businesses and make them aware of the individual coverage health reimbursement arrangements. If people have more money at the end of the month because the premiums are more affordable, then they have more to support local business.
To take the pressure off the people. And despite the changes, brokers still urge local people to make those decisions with a broker regarding their health care plans. But despite that, they say they can't blame those that have decided for now to go off of health insurance entirely.
All right, Gunter, thank you for that update.